Okay, so information, advice and support service. So not going to read all of this out, but just to be clear, this is a service that provides information, advice and support to children, young people and parents on education, health and social care. And these are children, young people with a disability and those with SEN. Okay, so it's set out in law, so it is a must-have. It's a statutory service. There is one in every local authority, and it is, it is not a nice to have. Oh, someone want to say something? I think that might be me echoing. Sorry about that. Hopefully it will go away. To read out more about them, so they're in Chapter 2 of the SEN Code of Practice. They have to be a dedicated and easily identifiable service. So they have to be a service in their own right and a standalone service. As we've said, matters relating to, which is what the law describes it as, and the code says that's education, health and social care. So that young people must be able to access information, advice and support services independently from their parents, and so must children. Children is birth to 16, don't get a lot of toddlers, but do get other children, and they have every right for that to be a confidential service from their parents, apart from in some very specific situations. So I think that's important to note. They have to be impartial, confidential, arm's length, free and accessible, and based on the law. So there will be local policy, there will be things that people say, and they will talk to people about local policy, and this is what happens here. But the information, advice and support they give must be based on the law. And if, on the very few occasions, local policy is contrary to that, the job of the service is to give the advice and information based on the law. Okay, joint commissioning. You'll all know this, so I won't go into lots of detail, but Section 26 of the Children and Families Act lists the things that must be jointly commissioned. And it says that the joint commissioning arrangements must include arrangements for considering and agreeing what advice and information is to be provided about education, health and care provision, by whom, to whom and how such advice and information is to be provided. So if you kind of track that back to the other sections in the Children and Families Act and the code and the regulations, that is your information, advice and support service. So this is a service that must be jointly commissioned. Why? I mean, other than the law, there are some other reasons why, well, there's a reason why it's in the law. What's in it for health? So support for parents and children and young people to understand and navigate the health system, rather from service providers. So the time that people take as a service provider explaining, now you have to go and see this person, you have to get a referral from here, this is how this service works. This is a service that will do that. They offer training because they have very good training themselves on SEND law, guidance, local policy and participation, minimising the risk of litigation and tribunals. So in the chat earlier on today, there's quite a lot of discussion about tribunals. So trying to get effective partnership between service users and professionals is really important to try and minimise that. So empowering children and young people and their parents to raise issues and concerns in a constructive manner that enables early resolution of disagreements, maximising the effect of gathered views and wishes of children and young people and their families, and meaningful consultation, so supporting meaningful consultation. This is one that comes up a lot, geographical and demographic mapping data. So that includes data on the nature of health inquiries. So services that feature heavily, feedback from children and young people and their parents on quality, ease of access, etc. We had one local area and parents were saying to the service, we only get 3 nappies a day for an older child, and they refused to give us any more. And that was a commissioned service, and that data came back, and then the CCG, did not recommission that service. They commissioned a new service. There has been, things about, well, this school or this place or this GP, we've had loads of people who just referred straight onto CAMS, or, from this school, we've had loads of school refusals, and that is then having an impact on the health services there. So it's a whole lot of data that services will have about a whole lot of children and young people that you may not know about, or the experiences of services that you may not be hearing about. Feeding into support to dynamic support registers or databases, come on to that a bit more, and support at CETRs, so care, education, treatment reviews. So I'm not going to read all this out. This is when we asked one service, what does that look like day to day? What are kind of the health inquiries that you get that you deal with? And there's a list here, including physiotherapy, CAMS, major one, personal care, specialist equipment, wheelchair, continence, speech and language therapy, specialist support. So that was what they said they were doing on a day-to-day basis. What does it look like now? So obviously Children and Families Act 2014, how's that going? Well, as we've heard earlier, not brilliantly in lots of ways. Joint commissioning absolutely not being one of the ways it's been going brilliantly in some places, but we are really pushing this with SENDIASS, and I think it's probably, we're going to do some more data collection in September. So 36% actually are, I think it's probably higher now, and at the time, so this is in February, 20% were actively working towards becoming jointly commissioned. So health have been, don't necessarily quote me on this, brilliant compared to social care in this. Health have engaged both nationally and locally really keenly and well in lots of places. We've tried to support this by me doing lots of this and coming and talking to people. We've got service level agreements. So most joint commission services are jointly commissioned on a service level agreement and not on a Section 75. We've got minimum standards, which people have based service level agreements on, and we've got an in-house one and an outsourced one. So people are welcome just to use them rather than do your own, change the names and stuff. But we know we have resources for people to use. And it's a really easy win. So one of the ways we kind of sell this is if you're kind of at the beginning of the joint commissioning journey, I believe it has to be called now, we're talking relatively small amounts of money for a big impact, and it's an excellent look. So if that doesn't make you do it, what will? This is just some data. It's a little bit out of date now, but it is health that we'll see that have kind of led the way on joint commissioning. So well done. And what does that look like? So obviously the aim is to be included in long-term budget planning and set out in an SLA or Section 75, and the vast majority of that is. So Kent have just agreed a joint commissioning agreement, which is £100,000 a year for 3 years. Kent is huge. Most others are not that big. And some CCGs are kind of still thinking about what that looks like for them. So when they cannot identify any resource, is that moving, well, any kind of financial resource, people have looked at moving staff, giving people office space, training. There's work with DCOs and DMOs and DISCOs, but obviously that should be happening anyway. And occasionally short-term targeted funding for a particular activity. So if we give you this money, can you get some data together to, show us what your health work looks like? Ofsted and CQC are very keen on SENDIASS as being joint commissioned. This was in a report of a service last June. It was very clear that the service did not have the capacity to follow its statutory obligations, and it was identified as not being jointly commissioned. And about a month after this, it was jointly commissioned. So it can happen incredibly quickly. This is a video which you're not going to have to sit and watch, but you'll get these slides and you can watch it. This is how West Sussex did it. West Sussex have a jointly commissioned service, and they and the CCG and their commissioner did us a lovely video just to talk about how that happened. A big thing for me and quite a bit of our work at the moment will be about this, commissioning across local areas. Lots of local authorities are tiny, and even if they're not, the ones that are tiny really struggle to have statutory services that are big enough. And I think hopefully that kind of the reorganisation into ICSs might give us some more impetus to the work of trying to support collaboration across local authority boundaries. So maybe in line, we've been trying to do some of that in line with CCG boundaries, and maybe there's a new opportunity to look at how we do that into ICS boundaries. So some of that might look like a shared health resource, so staff working across several local areas. Some of that might look at a shared telephone helpline across those local areas. There are lots of different ways that people can do this. We think it will offer economies of scale and improve service range, especially when they're just going to be too small. We're not sure quite how ICSs are going to impact on this, but we are encouraging people to have those conversations. And there is some more work we're doing, which we'll come on to, which is the co-location of other kind of information advice and support or advocacy roles. So if you have them in health or social care, might they be better being part of the information advice and support service and part of therefore a joint commission service? So quickly on to that, so key working. So obviously part of the NHS long-term plan commitment that by 2023-24, children and young people with a learning disability, autism or both with the most complex needs will have a designated key worker. So initially supporting children and young people who are inpatients or at risk of being admitted to hospital. So you will know this, so this was the recommendation, and there have been pilots. And in the key working guidance, it talks about the importance of an escalation or unblocking function in the key worker process. It's clear why they say that as people not doing what is expected or asked of them can be a real challenge when it comes to implementing care, education, treatment review actions. And an effective CETR is at the heart of key working. So that some of this is about challenge. Some of this is about advocacy, and some of this key working has to be about challenge. You have said you were going to do this. This is what you were expected to do. It hasn't been done. Why hasn't it been done? So most information advice and support services are pretty skilled and experienced when it comes to providing, positive and polite challenge to multi-agency teams. So the suggestion was that a key worker could be someone with an IAS background or someone embedded in an information advice and support service with responsibility for escalation or developing an escalation protocol where speedy admission avoidance is required. So we're mainly talking about avoiding admission. And these are kids and young people that services know. Ask every information advice and support service, and when we started talking about this and about CETRs, lots of them wouldn't know what you were talking about. And then when you talked about the kinds of young people that needed one, they knew loads. The thing is, no one else did, or no one in health did, maybe. So lots of the kids we'd talk about were then, what do you do? They went to residential placement, residential education placement. So others knew people and didn't, they'd never had a CETR, even though they absolutely should have. They know these families, and often they've known these families for a long time, since these children were very small. And actually, they're the first to know that, when the child going to school or is excluded or is off-rolled, they know about that. So it is all those families that they know about that they need to, both be working with and making sure health know about. So, looking at the key working. So the two of the pilots have involved the information advice and support service. The most advanced is Salford, who may be here, and if you are here, correct me if I say anything wrong. I have checked the slides with people, but just shout at me if it's wrong. And they are part of the Greater Manchester pilot. So in Salford, the key working service is based in the SENDIASS and is managed by the manager. So the information advice and support service manager manages the key working service as well. It is working towards, its aim is to have 2 members of staff who have 10 cases each. So the information advice and support service is seen as being very impartial, has good links across health and social care, and is able to support the key workers in their role, particularly in advocacy and challenge, alongside knowledge of the law and of the local population. When you're challenging, you need to know why and what your grounds are, and you need to know who you're challenging for. So most of the young people, as we've said, the key workers are involved with, are already known to the SENDIASS. When I talked to the manager about it, he said one of the biggest issues there've been is, it's really tricky to find anyone who meets all the essential criteria. It's quite a specific job. And in the end, they've decided that they need to be flexible. The relationships and building relationships is by far the most important aspect. I see I've copied that twice. Another pilot is in the South East London CCG. It's being led by Lambeth, and the plan is for advice and guidance key workers who will be employed by the CCG, but embedded in one or two of the information advice and support services in the South East London CCG, but working across all 6 local areas. So that is a slightly different pilot, more as we get it, because this is very early days. So I think it's incredibly exciting, and I think it has, the possibility of working really, really well, and it makes sense. It makes the most amount of sense. Now, I'm not saying that all information advice and support services are able to do this, but there will be one in every ICS CCG who absolutely is, and it seems a natural fit. But obviously we'll have to see how the pilot goes, and we will keep people up to date. I don't know if anyone is here from either of those areas who'd like to say anything. Okay, right.
I am, by the way.
Yay!
I was just switching on my camera in time. Yeah, so my name's Ian Sutton, and I work for South East London CCG, and I'm leading on the Key Worker project. I won't take up Daisy's time, but just to let people know that I am here and I can answer some questions if there are any later on in relation to how we're using the SENDIASS service to support that programme. So thank you, Daisy. Thank you.
Oh, brilliant. Thank you. And I'm so glad you're here, and we will come back to you at the end. That's brilliant. Okay, the last thing I want to talk about, before we can have some discussions, is how we're supporting that. So how centrally the Information Advice and Support Service Network and the Council for Disabled Children and, God love them, NHS England are supporting the development of the health offer in SENDIASSes. Because we recognise that while all services have good training on law and education, health and care plans and SEL and education, and they have lots of local knowledge about health and provision, there are gaps. So NHS England have funded some health focused training for service staff over the past couple of years, and most recently they've commissioned, we had a couple of webinars and then some e-learning on CETRs and DSDR, whatever the next initial might be. They're going to be rolled out shortly, and we're really hopeful that they will result in increased support for families. That won't necessarily be through a key working pilot, of course, but that's just more in the role of information advice and support services being there as advocates and supporting families, giving them information and advice. Okay, there are 4 modules, which is 2 more than we expected, but turns out there's a lot of information. This is a very brief overview of the module. So it is an overview for services about CETRs and DSRs, looking at the long-term plan commitment to reduce numbers of children and young people in inpatients, what CETRs are and what they're designed to do, what are DSRs, including the different nomenclature. Amanda Allard's word, never quite sure how to say it. And to look at who these children are, a profile of the children and young people we're talking about, those who are admitted, those who are at risk of admission, really trying to drill down who are they. And yes, you do know them. And if you don't, you probably should. So then goes into a little bit, well, it goes into quite a lot of depth, in fairness, about CETRs. So it talks about when they're held, about community pre-admission, about local area emergency protocol, post-admission and inpatient, how often they can be held, what happens, who's involved and what are their roles, and links to all the resources that are available, which there are a lot and they're really good for parents and children and young people, which explain the process. And we look at, what will be the role of information advice and support services in all of these. Okay, then we have some examples of dynamic support and risk register models, who's expected to feed into them, how they're used, and the information that SENDIASS services hold, which would be helpful to include, which we think is probably quite a lot, but we don't want to overwhelm people, obviously. So a lot of this is about what it is and what it isn't. You know, it's really clear. This is not everyone you work with who has autism and complex needs. You know, this is being at risk of admission. This is, you know, these are the children and young people. So it is being really clear that we don't want to bombard anyone with hundreds of children and young people. But one of the issues is trying to find out, if you were going to bombard anyone, who that would be. So obviously that is different in different places. So there are some suggestions if you don't know how to find out who does hold your local DSD. If you are on this and you do, you could be really helpful and just contact your information advice and support service. That would work perfectly. This is just one of the slides. The slides at the moment are just being looked over by NHS England, who appear to be a little bit busy. But this is about looking at the key processes that could help keep children and young people living in their communities. So you can have a couple of seconds just to look at that. Okay, so that's a very, very whistle-stop presentation, because I am aware that it is probably more useful for people to be able to ask questions and chat, particularly as brilliant Ian has turned up, which actually wasn't planned, but probably I should have. So thank you for making that better. Can you see me now, Thomas? Excellent. Excellent. Okay. So up until now, it has not been the most hugely interactive workshop, and I promised that it would be, because generally mine are just me talking. So I've tried to make it more interactive without me suggesting everyone just kind of has a little run around or plays deadlines or something, although feel free to do that if you must. But do people have questions? Alison has put her hand up and not just interrupted. Well done, Alison. Ask a question.
Hi everyone, I'm from Hammersmith and Fulham, and I chair our DSR, and we're a key working pilots. But more importantly, we've just gone out for recommissioning of our SENDIASS service, jointly commissioned with Health, and I contributed to the spec, put in stuff directly about Health and about CETRs and DSRs. And I have to say, really quite disappointed in terms of from the tendering process, the lack of emphasis of anybody put on Health as a SENDIASS service. So it definitely came third after Education, Care and Health. Health barely mentioned in some instances, and certainly nothing about, you know, playing into the fact around DSRs and CETRs. So yeah, I suppose that was just really sharing that as an observation, because I'd known that a lot of work had been going on around Health with, you know, from CDC and others with SENDIASS services and the NHS England sort of work, that just didn't materialise in the expressions of interest that we had in terms of, sorry, this is my cat who thinks that she's invited to every meeting.
Absolutely is. Absolutely is.
Tonic has a brother called Jin. Tonic knows Vicky well because she's in the DCO meetings and things. So yeah, she's a bit of a diversion. Very interested in all things Send.
She's a favourite member.
Absolutely.
So yeah, so it was just a bit of feedback really in whether that's other people's, and our previous SENDIASS, we kept asking for data about Health, and I met with them and briefed about DSRs and CETRs, and we put on our, if a parent is going on the dynamic support register, we have a link to our SENDIASS service in that sort of information. But I've felt, and I've been a DCO and senior DCO and other thing for 6 years now, that actually I've had to really push the where is health in sort of this, rather than the other way around. So that's just my local experience.
I suppose one thing I might say about this is that what we know is this has been harder for outsourced services. So the vast majority of information advice support services are in-house, and they generally tend to have more contact and work more strategically with different levels in the local authority and with CCG. So that's I'm not saying that's across the board, but that generally has been harder if you're outsourced. And because they generally are set with another organisation, they will have a contract that says your work is education XXX. So we have found that a harder nut to crack, and it has been, like you said, when you have gone out to retender and said, right, we are doing this joint commission, Leon, we are going to expect this. But I guess some of the organisations that will go for those contracts are less embedded in that world. So that'd be my only comment on that. But if there's anything you think I can do to help, email me and I will do it.
Yeah, and thanks. We had our first mobilisation meeting sort of yesterday, so I'm in there and will certainly be influencing, but know who you are and where you are, Daisy, if I need to come knocking on your door. So thank you.
Thank you. Anyone else?
Don't know if you can see my hand up, Daisy. It's Vicky here.
I'm sorry.
That's all right, don't worry.
Sorry, you're just waiting there politely.
I am waiting politely, yes. I mean, it was just really echoing Alison's feedback, actually, because I've had to experience two different SENDIASS services in two different boroughs. And in one, we did do some work with them around the dynamic risk register, it was called then. And they supported some of the actions coming out of CETRs, and that was very successful. But they were a service already in place, so we weren't sort of specifically commissioning in new, if you like. In the new borough, health just generally appears that seeking information, advice and guidance and giving information, advice and guidance, knowing what questions to ask is not as practiced for SENDIASS probably as you would expect given the length of time of the reforms, and a lot of it is often focused on therapies, delivery and education rather than a broader health perspective. And so I think probably it still needs quite a lot of support to SENDIASS services out there probably about how to do that from us and yourselves, I think nationally. It is when it works really well. I mean, from my experience, but often I found it more successful when we were growing our own, because they were already with new colleagues and able to talk to them and come back and say, we've got these queries coming up, not quite sure how to respond, or how do we do it? And they were because they'd been so schooled in being education focused, excuse the pun, didn't quite get that home school link and how behaviour plans work, home and school, etc.
Yeah, no, I completely take it. And I think that's part of our joint commissioning has been about kind of, you need to be having these conversations, and you need to, health need to feel that these are their services, but the services needs to feel that it is their job to be doing stuff around health. Absolutely. Like everything, obviously some of them are very under-resourced, some of them aren't brilliant, and some of them keep getting outsourced. So you don't get it is much easier sometimes with a solid service that has been there for a long time. So I would say for Ian, probably in Southwark, Lambeth are people that have been there for a long time, and they have all of those links and are very, very much based in the community. And that is absolutely possible in an outsourced service, but if you're outsourced every 2 or 3 years, it's harder to get. But absolutely, we are really pushing it. But I am absolutely aware that it doesn't come as natural to people as education. And when people are under a lot of pressure, I think they just kind of go back to what they know rather than trying to increase it. But we are going to push it. And if you find more resistance than you think is reasonable, again, please do come to me.
I think it doesn't shine strong in the minimum standards, and I think that might be partly where it needs to go in. At that point,
yes, and we might look at, if we redo them again, which the thought of actually makes me feel vaguely panicked, but I might just do it quickly on my own without any consultation. I could probably manage that, and then we've put this stuff, it must be jointly commissioned, but I think what we could really do with is more of maybe the SEM review will give us that opportunity to really strengthen what we mean when we say joint commissioning, and I'd like resource to be added in that, but what would that actually mean? So we can put CETRs and DS, we can put all of that in it. That's what it means for health. This is what it means for social care, because otherwise we just get a vague kind of EHCP stuff. We're not really drilling down, and I think maybe that would be a good idea. Thank you. Are there any hands up that I just can't see because? No. Okay. So yeah, it has been a and it remains a thing that, and I want health to know this, that health have been really strong on. So for all of you who have been pushing this and doing this, well, thank you, and please continue to, because it has, it has been notable. And I think where it's worked, and it's worked well, it's worked really, really well. I think it is still earlier days than you would want it to be in an ideal world. And that's for a whole lot of reasons. But I am hoping that some of the key working stuff, if it works, gives that additional kind of well, they're doing this bit and they should be doing some of the rest of it, So I'm hoping, because I have to, make sure these services carry on existing, frankly. And, and that are big enough to do that. And I think that kind of cross-commissioning and that joint commissioning and getting stuff like key workers in is the way to embed those services and for them to get better and better and to do what you need them to do. I think it's perfectly reasonable to say, well, if you're joint commissioning something, absolutely. Or if you're going out to tender, you should be saying, this is what we want. This is what we would expect. And that is entirely reasonable. That's what you should be doing, and the local authority should be supporting you with that. And I think it's not about health just coming in with a sum of money or a role and saying, here we are. It is about saying, these are our expectations of this service. This is how you'll work with us, and actually this is the knowledge we expect you to have. And I think that is, we will help you get that, and we can support you in that. But I think that is entirely reasonable. I'm so glad there's no services. If there's any services on this call, just, do that. Would anyone else like to say anything? Ian, how is it going in Lambeth?
Well, oops. Very early days. The advert's out now if anybody's interested. Have a look on NHS jobs. And we are still, we're kind of running ahead of ourselves. We've developed it as a model before we've kind of made the arrangements with the host local authorities that we want, because that was the nature of the deadlines we were working to. So we're kind of a little bit on the back foot, as well as kind of appointing somebody. We are in the process of going to all the relevant boards and strategic groups and so on to kind of get permission. But I think there are only advantages to the local authority, so I can't see how they would turn it down. It's fully funded, and I think it gives, as you were just articulating very well there, that it creates a bridge between SENDIASS services and CCGs and NHS providers. It's kind of been my experience coming from a local authority background and working in a CCG that CCGs, and I'm sure people have got very different perspectives on this, but it feels like there is a view that it's that old saying that if you're a hammer, every problem's a nail. And I think that my take on the NHS is that it can be incredibly inward looking and actually hasn't kind of put itself out there to understand what SENDIASS does and the benefits that it can bring to working in the NHS. We're forever kind of engaged in meetings where we're trying to get a young person out of hospital who shouldn't be there, and there's just some crazy little bureaucratic reason for it, and it's all clinicians arguing with themselves, perhaps not knowing that there is a kind of legislative framework to this, or needing to be reminded perhaps that they have to work within certain timescales, and that the young person that they're talking about has rights as much as anything, as well as kind of clinical needs. So I'm very excited about kind of developing that link between SENDIASS and health. I think it can only be good for everyone.
Thank you, Ian, and I obviously, as you know, I agree, and it's been your leadership in this has been brilliant. So thank you. And you know, the example.
Yeah, worth coming for that.
Yeah, there we are, and the cat, I think.
Yeah.
And being here where we have had people going. So something came from Barnes the other day and said, you know, it turned out that the SENDIASS worker was also able to kind of explain how the education processes worked in the local authority, because education hadn't sent anyone, which obviously is a whole other issue, but was able to explain what this and this and this and this, as well as being able to advocate for the family and the child about this is what they want, and actually this is what this is, you know, this education provision is there for them, whatever it was. So I think there's part of that giving that kind of knowledge of, you know, the wider education system and the local authority as well, which should, you know, ideally be the local authority, but maybe always isn't. And, you know, being someone that can advocate, you know, for that child. And I think, you know, where are these children, young people, where else do they end up? And who knows about them? You know, that's one of my things, is who know, you know, this is a service who will know about some that aren't known to anyone else. And we need to just try and grab them in, but not physically, obviously, because that would be totally inappropriate. Right, before I do go back and point it, this is, it's now the time. I don't know if you're going to be whisked away, but you will get these slides. It's a lovely video. I will send out my email address will be on something, but it's drussell@ncb.org.uk. So please do email me if you have any questions, or you just want me to go and be cross at someone. Excellent at that, in a nice, supportive way. But, you know, whatever it is that you need, I can look over a kind of a tender or something, and, you know, whatever it is, I'm really happy to do it, because we so want this all to work, because I think it is the most positive, or could be the most positive thing. So thank you very much. Excellent cat work, and excellent seeing you in. Thank you. Thomas, do you get to wish everyone away?
No, so the second workshop starts in 10 minutes. So if you want to leave this workshop and then you join the second workshop through the same through a different link.
Excellent. So so have some tea, quick, run around, do some interactive stuff, and feed cats, and lovely to see you all.
Thank you very much. Take care. Bye.
Thank you. Thank you. Thank you. Bye.
Bye. Oh, Ian, it was a pleasure. Thank you. Oh.
Well done. You're amazing. That's fantastic.
Oh, I hate it. And then I realised my slides were a bit messed up, and then
it's so hard though, because like you say, when you're delivering a presentation, you can't see anyone.
Just can't. I think I'm on Zoom, because it's just.
And also you feed off people's reactions, don't you? You know that you make a joke and you can see people laughing. Okay, ease you in, but you just don't know. You don't even know if people are there anymore. You're like, what's going on?
Yeah, you could just be doing it to yourself. I find it so hard, and then I kind of end up rushing through it, and I was like, oh God, I've got all these minutes left.